Starting today, isolation orders and designated clinics for COVID patients will no longer be used. The government will only release the number of PCR positive cases on its website. Those who test positive and wish to see a doctor must visit private clinics or the hospital authority's general outpatient clinics. Sharon Tang has more.
Things are perhaps a lot different from now on if one tests positive for the coronavirus. First of all, no more mandatory isolation. As the government encourages COVID patients to seek help from private doctors, we reached out to 10 private clinics in one district, and most of them said they will receive patients with COVID symptoms. But 2 clinics asked COVID patients not to go there. Instead, the nurses said they can tell doctors how they feel through the phone or find someone to deliver medicines to them. According to a government website, infected people can get COVID oral pills from 548 clinics around town. Family doctor Lam Wing-Wo said he understands why some doctors refuse to diagnose COVID patients at the clinics. He said the floor area of a clinic is usually small, which makes it hard to implement pandemic control measures. He added that some doctors may be extra cautious because of their age. Those who wish to seek medical help from the hospital authority's general outpatient clinics must make an appointment via the HA Go app or through one of the 7 care booking hotlines. But one hotline noted the quota for the day is already full. Also starting today, authorities will no longer announce the number of new infections via press releases. Instead, they will only release the number of PCR positive cases as well as death cases from time to time. The latest figures on the website show there are 358 new infections and 5 more deaths. Experts worry the data does not reveal all infection figures in the city, which makes it difficult for residents to know the actual pandemic situation. Meanwhile, all designated clinics for infected people have resumed general outpatient services. COVID patients and those who are not infected had to register at 2 separate locations. They were handled by 2 different groups of doctors. But all patients were seen waiting for medication at the same pharmacy of the outpatient clinic. Staff members told us they will speed up the work for COVID patients to minimize the risk of transmission in the area. Sharon Tang, TVB News.